Okay, guys. So today we have Kirill de Guzman. I definitely just said it wrong again.
No, you're fine. It's
Okay.
good.
She is my first female guest, so I'm super happy that you said yes
Yeah.
to coming on
Oh, and
here.
it's Women's Month.
Is it Women's March is Women's Month?
Yes.
Oh
Oh
man,
God.
see, there you go. I'm already liking this a lot. So she is a nurse as well as a business owner. So, Kirill, can you just tell us a little bit about yourself and how you got into nursing?
Oh, how I got into nursing is a very stereotypical Filipino way of getting into
Let's hear
nursing.
it.
So I graduated high school 2003
Mhm,
and went straight to nursing because that's what my parents wanted. Did that
mhm,
for a year in the Philippines, the whole bachelor's thing, but then we had to move here.
mhm,
And of course, life happened and all that. And I had kids, got married, and I didn't have a career. I was like
mhm,
in limbo. I was like, what am I doing? But for some reason, all the jobs I had, most of the jobs I had, took me into the healthcare field, even when my husband's in the Navy. So he
mhm.
was stationed in Virginia, and my job there was a home health connected to a hospital. So it was always healthcare.
Always
I
healthcare.
was like, you know what? Okay, fine. I'll go back since it's the most stable job. So I went back. I did my LVN
Mhm,
at American Career College here in California when we moved back. And at that time, my husband was stationed here in LA for as a recruiter in the Navy. So that worked out. He was able to help me with things at home while I was going to school. And most of the comments from the aunties, of course, why not go for your BSN again? Why don't you go
mhm,
straight for RN? Well, it didn't work for me. It didn't, well, at
mhm.
that time, it didn't make sense for me because my kids started kindergarten when I started my LVN school too. So I was like, no, I'm not going to torture myself
Yeah,
doing that. And my husband was here for just 2 years. So I'm not going to complete my whole BSN in 2 years.
yeah.
And nothing gets credited from the Philippines to here because it's been like more than 10 years when I went back to school. So, yeah, I'm an LVN for like, shoot, like almost 10 years now, I think.
And
9 years, I think. Yeah.
and that's an awesome thing too, because like I have family members that are like I think LVN and LPN is similar, right? Same thing,
Yeah. Yeah.
license.
Yeah. Yeah. It's
So
just called different in
yeah,
different states.
wherever,
Yeah.
yeah. So it's the same thing, and it's you're still a nurse. At the end
Yeah.
of the day, you're still a nurse.
Thank you. Thank you for saying that. Not
Of
a lot of
course,
people realize that.
of course. And then so you were originally in Virginia, and then now you're back in California?
Yeah. When we first moved from the Philippines, we were here in California. And then I went to Virginia for a little bit to see what it's like to be a military spouse because I never moved with him. That was the
Mhm.
first time. And after that, I was like, shit, no, I'm not doing this again. I am done. I don't want to move anymore. And that was it.
And
I never
let's
went
go
with
into
him
that.
again.
How is that? Like, so you have you're a wife of someone in the Navy. So
Uh-huh.
how often is he deployed? And did you move with him other times other than that one time?
No, I only moved with him once because the
And that
next
was it.
time he got deployed was in Bahrain. It was in the Middle East. So,
Oh,
no, I
Bahrain.
didn't go. So, and then after that, he went into recruiting in LA. So we're just like an hour from LA. So it
Hmm.
was it was okay. He was kind of home. And then where did he go? He went back to the Middle East and then went back to he's just Middle East and then
Here.
recruiting, which we got really lucky with the recruiting part because he gets to stay home. And then he did recruiting in Sacramento too. That's like 6 hours away. But he lived with his mom, so it was like, okay, perfect. You're still
You
home.
got eyes there.
Yes. Yes.
That's awesome. So, but enough
Yeah.
about your husband. Let's talk about you. Um, so what was your first job as a nurse?
As a nurse, I worked at a skilled nursing facility. I got hired as a new grad,
Hmm.
and I was a charge nurse for like 2 weeks.
Oh, dang! Like right away.
Yeah, because they were short staffed, and you know how they like using new grads as an on call nurse. So, oh, can you cover? Can you cover? Someone called off this, and that. I'm like, okay, I'm a new grad. I need to show face and
Yeah.
let them know that I can actually work,
Put your
even
best foot
though I'm like
forward.
like I'm a new grad. But so I did that for 2 weeks, and then you know how they have those billboard, like the cork board posting stuff. So
Mhm.
I saw hiring MDS nurse. I'm like, ooh, I know what that is because I worked in healthcare, so I'm like familiar with things, even though I wasn't a nurse. So I'm like, you know what? I'm gonna apply. 2 weeks in,
2 weeks
the
in.
the administrator was like, "Do you even know what you're doing?" I'm like, "Yeah." She's like, "Can you tell me about this job?" So I did, but of course I did my research before I did that.
Of course.
So, so it she didn't like it. She didn't like that I was that straightforward and that I was that willing to take that job as a new grad. But and then another 2 weeks came in. She was like, you know what? No one else applied.
So you got it.
So I got the job.
That's
So I did
awesome.
training for a few weeks and everything was good. I did that for a year and a half. And then
And
that's when I went to case management.
and is the case management in the same, like, kinda like health system that you're in, or a totally
No,
different?
it was a totally different setting actually. It's non-bedside. It's a health insurance,
Mhm.
and yeah, it's a totally different setting.
And did the MDS, help you get the case management job?
Definitely, yeah. Because as an MDS nurse, I did a lot of care plans and auditing the charts every single month, make sure they're complete, they're accurate. They
Mhm.
don't have documentations having pedal pulses when the foot is amputated, the
Yeah.
stuff like that. So it did help me as far as documentation, care planning, accuracy,
Mhm.
and yeah.
And just
That's
for everyone that doesn't know what MDS is, even though you kinda went into it right there, can you just, like,
yeah.
explain what MDS is?
It stands for minimum data set. It's actually the process that's the MDS part. That's the process that the nurses do. We're mostly like assessment nurses in a skilled nursing facility. Those assessments go to the state actually for payments and
Mhm.
reimbursements. All the assessments are there every single month. It depends on the insurance coverage of the patient. Usually 65 and up, they have Medicare. So
Mhm.
those have more assessments 5 days after admission, 10, 15, 30, and then quarterly and then annually. So
Dang,
it's a lot of paperwork.
that's
It's
a
a
lot
lot
of
of paperwork.
paperwork.
And not everyone likes paperwork.
But it gets you off the bedside, right?
Yeah. Yeah. And I didn't know. I still did like assessments face to face. I had to work in the facility, but it's not the same as being a charge nurse, having 30 to 40 patients, med
Yeah.
passing the whole day. You can't pee, you can't take breaks. So yeah, it beats that. So I went for it.
And then how did your boss feel about you leaving after, like, a year and a half of it?
Oh, she was sad. She was really sad. And it was right after a state inspection. So she was sad. But we did really good in that inspection. So she was sad that I was leaving.
Was there any reason why you wanted to leave that job to go to, the case management?
There's probably the state audits every year. I
Mm,
didn't like the feeling of being followed everywhere. It was just weird to me. I mean, I get the whole point of the audit and stuff since I do it now, but
mhm,
I don't know I don't know the facility is just not for me. I mean, it's not that bad. It was a good facility actually. It's a smaller one. It's like 101 beds. It's
mhm.
not as big as the other ones, but I don't know. It's just not for me. And I already had friends in case management, so they're like, "Just come. It's way different." So I'm like, "Okay."
Oh,
So
so
I
that's
went.
how you got into it, like, you saw other people doing it,
Yeah.
and then so now as a case manager, what's your role?
When I did case management for 7 years. It's outpatient, so we usually call the ones who are new to the health insurance.
Mhm,
Within a certain amount of days, we have to make an outreach, make sure they know their benefits, they have their primary doctor's appointments, And sometimes we also get we call them members. We get members who were recently discharged from the hospital, follow up with them, make sure they have their home health if they do have it, any equipments, DMEs, medications they need. And most, especially the elderly, they don't understand their authorizations. So we try to go over that. And yeah, not everyone checks their mail, so we try to go over that with them.
Like go over everything with them.
Yeah.
And like I've been going through your Instagram a lot, just doing my own research on you.
Hey, I get it.
So the one that we were just talking about a little bit before is that why would people say that you're not a nurse?
Right now with what I'm doing, or
or
case
like
management
before
in general?
with case management in general, or MDS and all that, is like
Yeah, because we don't work bedside, we don't give meds, I guess, and that's like the whole perception of being a nurse, I guess. And it evolved a lot. Even when I was in the Philippines, I see nursing over there and nursing over here. It's way different.
Yeah.
So yeah, I think people would say I'm not a nurse because when I'm not bedside, and not everyone knows what case management is.
Yeah.
Not everyone's aware about it. So yeah,
that's a thing that like I hate when people say like people aren't nurses, when obviously case managers a nurse, because I have friends that are case managers.
You actually have to be a nurse.
Yeah, you actually have to be a nurse. So
Yeah.
it's like, I was just talking about this on like a previous podcast where that just means you found a place that's better than the bedside. Like you found an option outside
that's
of
a
what
good
other
way to think
people
about it.
are doing it. They're like they could be slaving away backbreaking work, and then in exchange
you get verbally abused. It's not fun.
in exchange of the verbal abuse and backbreaking work, you just get to do paperwork. It's a different type of work. So it's like,
right.
Good for you on finding that option.
Oh, thank you.
Not,
thanks to my friends.
Yeah. And also just getting out after that, those few weeks of you working as.
Oh yeah, it took a lot of guts to do that.
I could imagine. And so, are you not a case manager now?
No, I'm no longer case management. I actually do audits now. I audit case managers now.
Oh, so you're just moving on up.
Yeah, that's the goal. Well, from that medical group that I used to work at, that insurance, I work for a health plan now, which is still an insurance, just like a broader coverage. And that place that I used to work at is contracted with a company I work at right now, so we get to audit them.
Dang. So how does that work? So you have to also go through the charts as well and make sure that their MDS person or their case manager is doing their job correctly?
Right. Yes. There's a thing called health risk assessment, those HRAs. That's what usually the case managers use to assess patients. And when members enroll into the insurance, they get to fill that out with the nurse over the phone. And then I just make sure all the information or any concerns that the member was addressed actually by the nurse, and it was taken care of. There were follow-ups within a certain amount of time. So yeah, mostly state and federal regulations need to be followed. So that's what we check.
And with each of these jumps, has your pay gone up every time?
Oh, I actually took a huge pay cut to be
in
this health plan. The salary I'm getting right now was my salary when I left almost 5 years ago.
Why? Do you mind me asking? Why did you decide to do that?
I prioritized my mental health.
I like that. I like that a lot because obviously, I was just talking about it with another nurse on the podcast where a lot of nurses like chase money, chase overtime, chase anything, just chasing the W-2 job of nursing, because obviously you could make a good amount, but is it everything?
Is it worth it?
Yeah. Is it worth it? people are doing 6 days a week of working or 7 days a week, but then they're
Oh,
not spending time with their
yeah.
family, their wives or husbands, or they do it for so long that they end up having their body like break down on them and they get sick. Like, is it
Yeah.
worth it? And to hear you saying you took a pay cut, it's actually kind of like refreshing to show that there are other ways
Oh,
and you
yeah.
could still be happy, you know?
Yeah. And it balanced out with benefits because where I
Mhm.
work right now is a nonprofit, so we get county benefits.
Oh,
So I get pension when I get older. It's a long-term goal for me because I see my husband getting his pension soon, like, and he's retiring because of 20 years of
20
service in the
years. Wow.
Navy. So I'm like, I want that. They the private medical group that I used to work at didn't have any pension. I'm not sure about other companies though, but this
Mhm.
one that where I'm working at, we get county benefits. So it's a lot of benefits. And we
And
get annual bonuses too. So it kind of balances out.
I think that more than balances out
Oh
because
yeah.
I was talking about it with people that left where I work. We have a union and we have a pension and all that, but they
Mm.
left for higher paying nurse jobs in like other facilities, but they no longer
Oh.
have a union and then they're not going to have a pension. So it's like, yeah,
Oh.
you're getting paid maybe like $5,000, $10,000 more,
Yeah.
but also their health benefits actually aren't as good. So
Mhm.
you're paying extra off that. And then now say if you did work that 30 to 40 years, like
Hopefully not.
hopefully not, but if you did, what are you going to get from this health system? Or
Yeah.
when you're done, you're going to get nothing unless,
Nothing. Yeah.
and whereas like where I'm working, where you're working, when you're done, you'll get something
Yeah.
because you
It's
put in
better than
time.
nothing. Yeah.
Yeah, right. You put in all this
Yeah.
time and work and make sure you're getting something out of it.
Right. Yeah. That's basically the thing. And I think a year and a half ago, they actually started a WEX account. It's like a wellness lifestyle spending account for us. And we get like
Mhm.
3,000 every year. You get
Oh, wow.
reimbursed for like facials or going to the spa or a gym membership and annual passes to Disneyland or
Oh, that's
Universal
awesome.
Studios. They do this company really promotes wellness all around, but that's why it's like really good. So I'm like I'm
Were you
really
always
happy.
like forward thinking into like how can I, like, obviously you saw the pay cut, but then did you know that the benefits were going to be better?
No.
Go-
HR did discuss like the benefits, but I was like, oh my gosh, my bills. I have to pay my bills and this and that. And then my husband said, it always works out anyway. Just take it. It's better for you. So I'm like, okay. So I did that. But I had to cash out my 401k from my old job just to make sure the bills are paid. I paid them in advance just
Mhm.
to because HR did tell me that, oh, since you're coming in an awkward time, like the pay schedule is off, you won't get your first paycheck until like 3 weeks after, something like that.
Instead of like the 2 weeks or something like
Yeah.
that.
So I'm like, oh shit, I need to get everything together. So I did cash out on my 401k, which wasn't that much at that other company that I used to work at, and made sure everything was paid. So it worked out. Eventually, it worked out because just gas driving an hour and a half one way was already a lot. But I
That's
did work
for your
remote a
job
few.
now,
No, that was the
but
old
before.
case management. Yeah,
Okay, yeah, yeah. But yeah,
but they
that's
did offer remote days too, and I did get that, so it wasn't too bad. But still, gas
still,
is gas. We're in California.
yeah. But that's good that your husband was super supportive of
Oh
you
yeah,
leaving that
yeah, yeah.
job.
Oh yeah.
And
He
the f
saw how I struggled.
what was it, burnout or
Yeah, it was burnout, and it wasn't the actual job that burnt me out. I mean, I can take the verbal abuse. We know members have mental health issues. I'm kind of used to that. I just roll with it. It's actually funny that we just roll with it, but it was mostly the management.
Oh, okay.
Unfortunately, it
Yeah,
was
that
it was
you
bad.
gotta
It was
blame somebody and they're gonna point the finger at you, right?
oh yeah, and you had no idea what was going on. We're like, huh? It's my fault. Okay.
That's yeah, that's one of the worst things about nursing too, is that
Yeah.
you'll get blamed for everything that you didn't do and also the stuff that you did.
Oh yeah. Basically everything. So
And
yeah.
we don't have to go into it, but obviously cashing out a 401k is something that is tough
Yeah.
because you have to pay it back or there's penalties or whatever.
Yeah.
But you had to do it out of necessity.
Yep.
And just to, when you're able to pay off those bills, like just you don't have to go into it, but was that just because you weren't going to get paid on time, like as your
Yeah.
normal time?
Yeah. And I know I got a pay cut. It was so I left at 34. I got hired for 26 an hour.
Oh, dang.
So it was
Yeah,
huge.
that's like a big
So
pay cut.
I had to make sure I had something just in case. So yeah.
So and is that your current hourly right now?
No, since then, because COVID happened, they did like 3 or 2 market analysis studies for the payroll. So we got those 2 increases, and then cost of living allowance they did twice as well, and then plus the annual bonuses and the annual merit increase. So I'm like 35 right now.
Okay, so that's pretty good.
It's still on the low
The
end
low
for
end. Yeah, for
California.
California.
Because that's my rate when I left the other job 5
Yeah.
years ago. But since it's county, that's
The benefits come into play.
yes.
So that's always like a tough part too. If we're going to talk about finances for a little bit here, is that nurses in California can get paid ridiculous amounts.
They do.
And it's amazing, but you're also not in like that part where you're making that 100 to almost like $200 an hour.
No.
That I see a lot of like Northern California people making.
Yeah, no. They're most of them are RNs, but there's a lot of LVNs who make. I know some of my friends make more than 100 because they never left that company that we used to work at. So they're at like yes. Right now I think starting for LVNs is like 40, 45.
That's almost like New York City for
LVNs.
for BSN.
Like,
that's crazy.
So I'm like, huh? They're like, do you want to come back? No. Still no. Heck no.
So let's talk about that.
I'm good where I'm at.
You're happy where you're at with the lower pay.
Which is weird.
Yeah, like I'm not sugarcoating it. Yeah. How are you doing it? Like, because you seem, just talking to you right now, you're a very happy person. You're a very like bubbly person. What makes you tick? Like knowing that other people with your same degree potentially are making like double, triple.
I get to work from home, and not everyone gets to do that. And I get to spend time with my kids. They're teenagers now. They will be out for sure sometime soon. So I won't get to do that. And knowing that my husband was away for like a few years, I didn't regret leaving bedside and taking that pay cut. I never regretted it.
That's huge. And then obviously you have small business here.
Yes.
Can you go into that as well?
Sure. It actually started during the pandemic, as everything did, I think.
Yeah.
So I started sewing masks for my kids because nothing fit them. And actually me too.
Kids.
Yeah. So I started doing that. Started giving it to my friends' kids, and then I started making adult ones too, like cute ones to match their scrubs and all that.
Yeah.
Because I still had friends who worked bedside. And then one of my I used to work with her. She was one of our care coordinators. She was like, "Hey, why don't you sell it on Etsy?" I'm like, "What the heck is Etsy?" She goes, "It's this website. Just do it." I'm like, okay. So I just posted pictures, just random pictures, and people started buying it from out of state. I was like, oh, okay, we're on to something here.
Wow.
So, yeah, I started making like 500 every 2 weeks on Etsy alone. At that time.
How do you make the masks? Were they handmade?
Yeah, I have a sewing machine. Because I'm short. I'm only 5'2", so I tend to I hem my own pants and my own scrubs and all that. So I had this sewing machine. It was just sitting there. So I'm like, you know what? There's patterns we can download and all that stuff. So I just made them for my kids, and yeah, it all started there. Yeah. And so when the demand died down, I started like personalizing cups and tumblers and shirts and all that stuff.
S-
So
let's
yeah.
go. Let's stay in the mask for a second. We'll go into all that. So, how much were you selling the mask for?
They were like $15. And
Oh,
they were like
dang.
reusable, washable things. Yeah.
$15.
And it
And
had like the pocket inside you can insert a filter.
oh, you did everything. You
Oh yeah.
really went in on it.
With adjustable ear cups and stuff.
Not to go into your business, what was it like lucrative during COVID?
Uh I think it yeah, it was.
That's awesome.
Yeah.
That is
I just
so
did it
cool.
too because my husband wasn't home. He was in Sacramento at that time. So I was like, this anxiety is like giving me, it's like getting worse every single day. I need something to do. And even before, like with all the crafting stuff, I loved cooking and baking. And I did that every single day on FaceTime with my family. So I was like, I need something different.
That, so,
So I did that.
were you always like a creative type where
Yeah.
this kind of just like, let me do masks and put designs on it, and then once you did start selling, you're like, oh wow, I'm making money.
Yeah, I actually already I think my first business I was in like first grade.
Oh
So
wow,
it came naturally. It came naturally.
that's
I was
awesome.
selling like stuff to my classmates and they would buy it. I'm like, "Oh, okay. Sure."
That is so when obviously COVID died down a little bit, and then I guess the need for masks died down, and then you said you started making other things.
Yeah.
How's that? Is that just as fun for you?
Yeah, I started taking most of them were custom orders. Like they wanted like shirts for their kids, like gender announcements, baby shower stuff, event banners, just cutesy stuff.
And is this all on
So,
Etsy as well, or just on your website?
um it's not on Etsy anymore. It used to be on Etsy and then they started putting on fees over
Oh
fees
yeah,
over
yeah, I heard
fees.
about that.
So I made my own website, and that's where Crafty Kai was born. CraftyKai.com was born.
Yeah, I'm looking at it. That I wish I remembered to order the crew neck earlier so I could have wore it today too. But it is really cool because I remember seeing like the antisocial social club and all that, then the antisocial nurses
Yeah,
club. Pretty cool. Like a lot of your posts say you're a very introverted person, which is
yeah.
hard to believe because how easy you are talking to me right now.
Uh, I just, it's mostly like if I don't feel comfortable with a person, then I'm quiet.
I see. So
So
hopefully this is
you're good.
not bad.
You,
It's because we're
you
both
passed.
Filipino. That's it. Like, oh, you're brown too? Cool, cool.
Yeah, that's cool. Oh, you look like my cousin. Cool.
So has this been catching on, the antisocial nurses club, for you?
Initially, yeah, but I haven't been posting as much because I kind of hit like a creative rut. I don't know what's going on, but yeah, yeah. If you noticed, I haven't been posting as much. I used to
Mhm,
post like every single day
mhm.
because I'm like torn between do I post something about my crafting thing or do I post something about nurses? It's finding the niche of I have no idea what to do anymore because Instagram keeps changing.
Oh, it does, yeah.
So I'm
That
like, what in the world? I'm like, no, I need to take a break. So
so that's the question, because I saw that you have the 2 Instagrams. You have the
yeah.
Antisocial Nurses Club and your, Crafty Kai. How come you don't combine it? Because you have such a big following on the Crafty Kai one.
Because most of the Crafty Guy one are other small businesses. They were following me when I first started. That's when Reels first came out. That's why I had like a lot of followers. Now I don't get new ones. They're mostly like, I don't know, just random followers, I think. And other small businesses or like pop up markets that you get invited to like sell stuff.
Mm.
So it's mostly that, because yeah, it was the pandemic boredom. That's the 30K on Crafty Guy.
That's still that it's so awesome to see because like I have a similar thing too. My YouTube channel used to be a like personal finance investing YouTube
Oh,
channel that's got to like 24,000 subscribers, and then I just kind
oh
of
wow.
then I was just like, oh man, I hate doing the research and then having to share it, and
Right.
I have to put all my thoughts together to share it properly.
Yeah.
And then I made like a second YouTube channel for this, the podcast and nursing content and all that. And then I got so tired of switching back and forth that I was like, you know
Right.
what? Fuck it.
It's
I'm
exhausting.
just gonna
I get it. Yeah.
delete everything on the big channel because it has my
You
following there.
did?
Like, it's all like private, so you
Oh,
can't
okay.
see anything. And then I moved all the nursing content to the big channel because it
Oh.
is already monetized. So at least in my brain, it's like if
Okay.
things go well and things are picking up, then I could get like AdSense money and all that, and then it will help with getting people like you with like a 35,000 follower kind of thing to be like, oh man, he has 24,000 subs on YouTube. I should go on his YouTube. It's like a little game that I had to play in my head to be like, you know what? Even though everyone was looking for the finance content, I don't want to do that anymore. I want to do the
Right.
nursing stuff where we could talk about finances. Sure, why not?
Yeah.
But
Yeah. We did.
yeah, we did exactly.
Yeah.
But this to me is way more fun because I don't have to like prep a whole week for
True.
one video where
Yeah.
I could interview people and just have fun talking to people and conversing about how you're juggling life, personal finances, nursing, family, everything. Just way more fun to do. So like that's what I was looking at your Instagrams. I was like, damn, why didn't she just keep pushing this 35,000 followers and just do
Well,
the
when I
nursing
post
content on there
reels,
too?
I do the collaboration thing. So
Oh,
I
okay,
post
yeah.
on both. So I guess it works. But I'm I don't really sure what to do with. I'm not really sure what to do with my accounts anymore. So it's just there right now.
No, because I feel like you could have such a big reach with this. And I don't know, like you're a nurse. Nurses
Yeah.
love supporting nurses.
Yeah. That's true. That's so
Uh,
true. It's like a nursing fraternity,
yeah.
an invisible fraternity among nurses.
And like, do you follow I had him on the show, Jumer Adeline by any chance?
Yes, yes, I
He
do. I
he
do.
just message him. The dude is so bright with his Instagram coaching.
I
He
see his posts. That's why I was like,
like
oh,
he'll probably
dang.
tell you the same thing. Like you already have 35,000 followers.
He actually sent me a message. He said, "Oh, I love your content. Congratulations." I'm like, "Oh my god."
He's such a
I was
cool
like,
guy.
Thanks."
He is such a
I'm
cool
like,
guy.
"Okay."
And he's definitely someone that like I just keep saying he's definitely someone that can help you push this all together and probably make your business huge because like you're making really cool stuff. Like I wouldn't have bought your crew neck if I didn't like it.
Thank you for being honest.
No, I gotta be. I gotta be. Like I actually want to buy my wife one of your shirts here. Like the I don't judge anyone shirt. 'Cause
Oh,
I find that one something that she would definitely wear.
yeah, I do that too. So, yeah.
Like have that like little RBF too while wearing that.
Uh-huh. Yeah.
So for your business, is y- are you going to continue making all different types of like wearable stuff, or what are you trying to do with it?
Right now, I'm just going with the flow, I guess. See where it takes me. Um, like I said, I'm like stuck. Like, what else? I have caps, I have hoodies, crew neck shirts, keychain stickers. I'm like,
I think
and
that might, you know what, that might be all you need. You just need to start getting back on social media and just
yeah,
putting your face back out there again.
that's what I told my husband. I was like, maybe that's all I need. I don't need to make it complicated because there are restaurants who sell one freaking dish and they're like
They're
amazing
they're
and
amazing.
successful. So I'm like,
Like shaved
maybe,
ice places. You just do shaved ice.
right? I'm
And
like,
that's
what
it.
the heck? And
Just a little
syrup,
different
that's
flavor. A
it.
little syrup.
Like the heck? So I just need to keep posting more, and
And
yeah.
that's and like you definitely have a creative side. You definitely have a funny side from what I'm seeing. So really dialing into that nursing, I think will get you where you want to be.
Thanks.
Yeah, and like so you're working from home, right? So
Yeah. So
is it
I
like
have time.
it, it is it 8-hour day, like 8
Yeah.
8-hour days?
It's
Like
8 to 5, and I have an hour lunch. So
okay, how does it work? Do you have to like clock in? Kind of like how does it or
oh,
just
that's
get
the thing.
work done?
I'm salaried. So yeah. And I can do my work ahead of time. So
So you're good.
I'm yeah, I don't seriously, I don't have an excuse. I'm just like exhausted probably from like a couple of years of posting every single
Oh yeah.
day and coming up with I always feel like I need to come up with something new. I see a lot of content creators say just reuse it, put something different, put a different caption, put a different text. But my brain just can't click with that concept. So I'm
Oh
just,
yeah.
it's a
Uh,
struggle.
that's the same with me too. They're like, oh, just reuse the same clip. I was like, but then if they scroll, they'll see the same clip.
Right.
It's making me look lazy.
And my husband's like, not everyone's scrolling back. That's just you. I'm like, but
That's probably
yeah,
true.
yeah, I tend to overthink things. So yeah, so I exhausted myself.
Yeah, that's probably the stress and exhaustion of probably us just thinking too much about our own stuff
Oh
that no
yeah,
one else could see. Like, oh man, I'm so tired
yeah,
of
that's
judging
true.
myself.
That's so true.
So, man, there's so much you could do. But so for let's go back into the case manage. I mean, the your auditing role. So
Okay.
you said you could do things ahead of time. So do you have the tasks already set out for you for like the week or the month or something like that?
It's right now it's 6 months out. So I have audits scheduled until 7. So until July. Wait,
Oh, so
yeah,
so you
July.
could so you could
It's scheduled ahead of
technically
time.
so if you wanted to and you're moving ahead like faster, you could just do it and be done if you
Yeah.
wanted.
But every single month, like the new list of patients come in, like the new members of the insurance come in. So I get to pick what I'm auditing, but usually I usually take the list from a month or 2 months before. So right now it's already March. So I'm auditing January new members.
Okay.
So I get to go back and just do it in just a couple of months
In
advance.
advance. That's
But
pretty
the
awesome
actual
though.
audit schedule is like months ahead.
That's a pretty cool work pace that you could
Oh yeah.
do if you really wanted to. You could if you really wanted to, can you get it all done like in a month and then have like 5 months off? I don't
Not
know
5 months,
if you
maybe 2. That's max. Yeah. I went on like a 3-week vacation. We went to the Philippines and Japan last summer, and I already had everything done before I left. So my coworkers just had to do the actual auditing online, but all my paperwork was done. All my file selections were done. All the files were reviewed, documented, everything. They just have to put in the scores if the case managers did it or not, and that's it. Send out the results, and that's it.
It's awesome. See,
Yeah.
like this is like the stuff I like talking about. Like, see, like all these people doing like bedside nursing and all that, but then you could find like the option of finding how you're working. Yeah, you took a pay cut,
Yeah.
but look, you have a little bit more time freedom than
Oh yeah.
everyone else. Like, so I'm not sure you're allowed to say it but like you took a vacation while you're working.
Oh no, I was on PTO, but
Oh,
I
you
got
were on
everything.
video.
Yeah, I
Okay.
was officially on PTO.
I thought it was one of those things where like no one should know, but I
No,
actually
no, no, I was officially on PTO. I actually
okay.
maxed it out, but yeah, we gotta use that PTO
Oh yeah, for
eventually.
sure. But like that's one of the coolest things. Like there's so many different career paths in nursing where
Yeah,
you could have more time freedom, more less backbreaking work, and just a happier life. And to go into family, I'm assuming you're my age. You look very young. I'm 34, and
I'm 38.
oh,
I'm older. I'm your ate.
and you're how old are your kids?
17 and one's turning 15 next month.
Dang.
I
Yeah,
started early.
I only have a 3 and a 1-year-old, so
Oh,
how
fun.
is a lot of fighting, but I'm sure it's a whole different thing when they're teenagers. How
Oh
is
yeah.
taking care of teenagers?
I
Uh,
have two boys and I grew up with two brothers and a lot of guy cousins, so I'm really comfortable with them. Maybe if I had a daughter, I wouldn't know what to do with my daughter. So I think boys are easier. I'm being
my
biased, of course,
might
but I
be
just think boys are easier.
like my son is a menace, so
Oops.
my daughter is the easy one, but
Oh,
they're still young, but I'm sure it'll switch once they're older.
for sure.
So, and do they like that you're home, that you work from home?
They do. Because I get to pick them up early when they don't feel well at school. But yeah, they do like that I'm home, and like I mentioned earlier, their dad was always away. So
Mhm.
it helps that there's someone at home just in case something happens, or like when COVID happened, everyone was home. So they had fun. We actually had fun during COVID being home together.
And so since you're home, when do they like disrupt you when you're working at all or anything like that?
No. They know. I just let them know that, oh, there's food downstairs. Here's what's ready. Or you can make ramen or pancit canton
Oh
whenever you
yeah.
want, but there's food downstairs. That's all they need. And they stay in their rooms. My 17-year-old, of course, already drives. And so they go to school together. I don't worry about anything anymore.
Oh, that's awesome. So like
Yeah.
that's probably also like another big thing too. Like if we went back into finances and like you don't have to pay for like babysitting
Oh
or
yeah, that was a
daycare.
lot. Oh, I can't imagine. And now like daycare's a lot.
They get
It's
paid a
like,
lot.
yeah. And if they're not potty trained, you pay extra. Oh
Well,
my god. I'm like, what? Isn't that part of your job?
to teach them, I can't
I'm
do
like,
doing everything.
you have to do something.
Yeah, so like I was just talking about with I went out with a friend yesterday and they're talking about daycare is like 1,500 a month, and that I think that was just for like
What?
one kid, and like it'd be more for a second kid. And then I was like, how do people financially do this if they weren't like a nursing job where they could work from home, or like me and my wife are both nurses where we could split up our
Oh,
schedule where
right.
someone's always home. Like that's the only way we've been able to not send our kid to daycare. Obviously, it just exhausts us because
Yeah.
working and then taking care of the kids.
Well, when
So
my kids were younger, I got really lucky. I have two brothers who were willing to babysit
that's really cool.
when they didn't go to school. So yeah, I was pretty lucky to have someone.
Yeah, yeah, that's huge. Like I don't have that. Uh, my brother has his own kids to worry about. All of her
Oh yeah, both
all
my
my wife.
brothers are single, so I'm really lucky.
Yeah. So, but yeah, that's awesome. And then obviously, yeah, oh shoot, I don't know. Sorry. I don't know if you heard that. Like my Instagram just started using all the volume. Uh,
Oh no, you're fine.
uh, but and then so if you were to do anything different for your nursing career with everything that you went through, would you do anything different?
No, no. I would go to school twice still, do my BSN for a year, and then leave, go somewhere else, do
I
an
don't know if
LV.
you're being sarcastic right now.
uh no, I'm good where I'm at. I think I wouldn't change anything. Still an LVN. If the situation changed and I didn't have kids and wasn't married, just single here in California, I'm probably not a nurse.
Oh yeah,
I'm
well,
probably something creative. For sure I have a business cuz I don't know, I've always been into it, probably because of my exposure with my parents and grandparents. But yeah, probably something creative.
oh, that's cool. I like that you brought that up because I feel as Filipinos,
Mm.
we're told stability and security. So you
Yeah.
go into healthcare, especially nursing.
Yeah.
But yeah, so obviously, like you said, it was like not necessarily forced to you, but it was the route that gave you that security and stability.
Yeah. Initially it was forced and then I forced myself.
Initially, oh yeah, the
Yeah.
first time around.
Yeah, the first time around. And then I forced myself because I didn't want to go back to school. I'm like, I'm fine. But then the recession happened. I'm like, I need something. I
Mhm.
need something. So
And since we're going to be coming up on the hour, we'll be closing this up soon. If anyone wanted to contact you, how would they get in contact with you?
well, like you mentioned, I have 2 Instagram accounts. You can pick whichever one you want.
Are you active on both?
Yeah, I'm active on both. So one's crafty.kai, crafty dot and then CAI. And then the other one's antisocial.nursesclub. So yeah.
And if you were to give advice to anyone that wanted to start a business, what would it be?
Just go for it. A lot of people overthink it. This time I didn't overthink that part, which is weird. I just went for it. I just uploaded it on Etsy. So you'll never know until you try it. So just do it. And not all businesses are successful, and that's okay. Shit
Mhm.
happens. Life
Shit happens.
happens. So just go for it.
And last question. So if someone wanted to go into nursing, would you tell them to go the LVN route, or what would your advice be for someone going to nursing? Just general.
Make sure you really want it. Some people say it's their calling. It wasn't my calling. It just happened. But just make sure you want it, especially with the situation right now. Everything's on social media. Do your research. Make sure you want it. And as far as LVN, RN, BSN, ADN, I mean, that's really up to you. Everyone's situation is different. Do what works for you, do what makes you happy. At the end of the day, it's about you, not whatever other people say or your family, friends, your aunties and uncles. No, it's all about you. You're the one who's doing the job.
All right. So, okay, I said that was the last question, but one more. Why?
Go ahead.
Why didn't you chase the money of nursing jobs?
That's a good question.
Yeah.
Oh,
You got one.
I remember. There was this one auntie at work. She was an older nurse at my old case management job. When she found out I applied for this nonprofit health plan, she told me that was her biggest regret, not going for the county hospital that she applied for like decades ago. It's like now that time that she was thinking of retiring, she doesn't know what to do because she won't get pension. So I'm like, okay, I don't want to grow older like that. And I don't want to be a burden to my kids not knowing what to do. And my parents came here late. They were in their 40s. So I'm like, I don't want that to happen to me too. Like starting late, not having something for retirement and all that. So I'm like, okay, yeah, it's that what made me go, like it gave me confirmation to go for that job. So yeah.
Yeah. So Yeah, so that's huge. So instead of chasing like the hourly salary, you went after the
The
benefit that
benefits.
will help you in the long term.
Yeah.
And I think that's huge for any like nurse or anyone going into any job to look at the long term instead of that initial big salary. And
Yeah. And for an older Filipino nurse to tell you that, it's a big deal.
yeah, huge deal.
It's a huge deal.
One of the
That's why I'm
titas
like,
on you.
uh-huh. And then she followed up on me after. She goes, there's not much Filipinos there, huh? I'm like, yeah, there's barely Filipinos here. And like in my department, there's like three of us, which is weird for
Yeah,
nurses to
for nurse.
just three. That's so weird. And you're in California, but yeah. And then she said, because they don't pay much. Filipinos are in for the money. That's why I stay there. I'm like, okay, staying.
Yeah, like I don't want to go into it, but I bring this up a lot too. Like Filipino culture is a lot of flex culture, and how much are you making? What are you wearing?
Yeah.
What are you
What are you
driving?
driving? There you go.
And
Yeah.
it's
Where do you live? How big is your house?
gross.
I'm like, oh, heck no.
Yeah. So I'm really happy that that's from what I'm seeing. I don't know. That's not who you are.
Yeah, no,
And that
I'm not.
that you broke that mold and you found that
Yeah.
job that is going to give you that long-term stability
Yeah.
and what you need out of it. So,
Thank
Ka-
you.
thank you so much for hanging out with me and being the first
That was
female
fun.
guest here. Yeah,
I was
hopefully we can do this
nervous, but
again.
that was fun.
I try to make this as easy as possible. Like,
Thanks, cousin.
no, this was a lot of fun. I really appreciate you hanging out with me, and you figure something out with your Instagram. You could be
I
doing
know.
such
Yeah,
big
maybe I'll
things.
DM Joomer sometime in a few months.
Yeah. Thank you so much again, and hopefully we could do this again soon.
Yeah, thank you. Thank you. I appreciate it.